Hello, I'm Dr. Shiba from my clinic. DermaQual is my favorite brands of threads, and today I'm going to walk through the procedures that we did and that's why I prefer these type of threads. So we're using here the 12D threads. I mainly use them for lower facelifting. They are my favorite threads when it comes to lower facelifting, especially for patients who are a bit overweight or we don't want to add more volume to the face, especially for patients over 40. They are a good choice to go. Usually in each side I use 4 to 6 thread depending on patient's age and the level of sagging. However, if the sagging is too much, of course the patient will be a candidate for surgery. And then I use meso threads in marionette line area, even in nasolabial fold. They are a good choice. And also for this specific patient, I'm using them for eyebrow area because she doesn't want too much leaf, but as you can see there's a bit of wrinkles in her face, and meso threads are very good treatment for fine lines, for wrinkles, because how they stimulate collagen and neocollagenegenesis, they improve the texture of the skin. One more important point that you should have in mind, I see some doctors in trainings or in their commercial videos, when they are advancing the thread, they just do it in one move, really risky. It doesn't matter whether you're experienced or you're just starting your thread journey. I always take my time when it comes to advancing the thread, because every inch that I advance the thread, especially when it comes to lower face, I make sure that I'm not catching the muscles with my thread. So I always ask the patient every inch after advancing my thread, I always ask the patient to smile, to say something, to make sure all her muscle movements are comfortable. When we are advancing the thread, because of bruising, because we are kind of dissecting the area, of course the patient feels a bit heaviness, but when they speak or when they have facial movements, they should not have any pain. If they have pain, you have to immediately retract your thread and choose a different pathway. This is really important, especially if your patient has a job that involves a lot of talking, like a teacher, like a lawyer. This is extra important. For the meso threads, also what you should have in mind, I see again in a lot of commercial videos or other doctors training, they try to pull all these threads together, which I don't find it very logical, because when it comes to meso threads, they're very small, especially the PCL is transparent. It's really hard to see it. And plus, for me personally, I do it with local anesthesia, so obviously patient is going to be a bit swollen. When you remove the threads in groups, you might miss the entry point of the thread, and a bit of thread might be inserted in the skin, which might cause a lot of reaction, which might leave a scar for the patient. So always, no matter how busy you are, try to remove the threads one by one, and especially avoid recording this in your commercial videos. It could have possibly legal consequences even for you in case it's left for the patient. And plus, always ask the patients when it comes to meso threads to come back to you after 1 week for you to make sure there's none of the threads are showing on the skin surface. If there is any, either remove the thread or just cut the extra piece. When you want to insert 12D threads, so the gauge of DermaQual threads, 12D threads is 19. So you're gonna use a needle, of course, bigger than the cannula. You're gonna go for an 18 gauge. You make a very generous entry point with an 18 gauge. Usually one entry point is more than enough, even for up to 6-7 threads. However, you are free to open as much as entry points you want. If you're not confident that the thread will comfortably pass, you can have more entry points. It's just a matter of personal choice in practice. Both methods are safe. However, I prefer to have just one entry point. I mainly use 12D in my practice for facelift. I especially prefer it for lower facelift. When it comes to jowl area, it's really effective. Sometimes I use it for eyebrow lifting as well, for patients who are scared of double arm needles or they have never done threads, they are not sure of what they want. I go for 12D as well. Or for example, for patients who are on blood thinners like aspirin, I'm a bit afraid about bleeding, I'll go for 12D because it's just single arm and the risk of bleeding will be less.